an illness that has stricken 11 people in Argentina, killing 4, may have been the result of legionella, the bacteria that causes legionnaires' disease, health officials said Saturday. Officials had been trying to determine what was causing the malady that had sickened 11 people linked to a private clinic in the city of San Miguel de Tucumán, about 1,080 kilometers north of Buenos Aires. On Saturday, health officials said legionella bacteria were identified in tests of 4 samples, 3 respiratory and a biopsy from one of the people who died. For more health and well-being related news and videos, check out Health and Well-Being. The suspicion is that it is an outbreak of Legionella pneumophila, Health Minister Dr. Carla Vizzotti said. Data is still preliminary and pending final diagnosis, Vizzotti added. Legionella bacteria can be transmitted when people breathe in small droplets of water or accidentally swallow water containing the bacteria into the lungs, according to the U.S. Centers for Disease Control and Prevention. It can cause Legionnaire's disease, a serious type of pneumonia. The 11 patients linked to the Luz Medica clinic include 3 people who were under observation and receiving treatment, as well as a 64-year-old man with pre-existing conditions, or comorbidities, who was hospitalized in serious condition, and an 81-year-old man who was also hospitalized in serious condition. 3 employees at the clinic also contracted the illness, a 40-year-old pharmacy assistant who was hospitalized, a 44-year-old nurse being monitored at home, and a 30-year-old nurse, Provincial Health Minister Luis Medina Ruiz said. The Tucumán Province Ministry of Health said on Saturday that a 4th death has been tied to the cluster. The deceased was described as a 48-year-old man with comorbidities who had been in serious condition at a hospital. The 3 other people who died also had pre-existing conditions, the ministry said. Patient 0, a 70-year-old woman who had gallbladder surgery at the clinic, was among the deceased. She was at first considered the cluster's patient 0, but her case will undergo further analysis, Ruiz said. Symptoms, which first appeared in 6 cases related to the facility, developed from August 18 to 23, provincial health officials said. The latest cases included 3 patients announced Thursday, 1 announced Friday, and the 1 announced Saturday. The World Health Organization's Agency for the Americas, the Pan American Health Organization, said Argentina's Ministry of Health informed it of the initial cluster of 6 patients on Tuesday. WHO said Thursday that hallmarks of the then mystery illness include bilateral pneumonia, defined by infection in both the lungs, as well as fever, muscle aches, abdominal pain, and difficulty breathing. Tests for respiratory viruses as well as other viral, bacterial and fungal agents have so far been negative in the first 6 cases, WHO said on Thursday. At a news conference earlier this week with Ruiz and other medical professionals, it was announced that initial testing also appeared to rule out COVID-19, Legionella and hantavirus, which can be spread by rodents. Additional tests, including those that would find non-infectious, potentially drug-related or toxicity-fueled causes, were being conducted at a national laboratory run by the Argentinian government, WHO said. With Isabella Espada Sparosleal.